this. In this is because many of my colleagues are already given the healings, how the wound heals apply. Ultimately, such a wound healing takes place into a fibrosis. If we look after this treatment of such a condition where the fibrosis takes place, we add antibiotics, we add painkillers, and when it ends up healing with the fibrosis, we need a surgery for that. This is adding cost. Suppose in this place, if at the level of inflammatory cells, if we can replace with the healing factors and stem cells, possibly the next steps of organ recovery doesn't come. This is how we can change the parameters of treatment. A simple example I can give you, like one small child, while playing he falls down, the wound heals within small scar formation or no scar formation. Whereas in adult, if he falls down, the wound heals within big scar formation. Now this scar formation indicates that the potential of stem cells are less in the adult people, whereas in small children, the potential of stem cells is very high. Now some of the examples which I like to show you is non-healing wound. This is a tropical ulcer which I did clean debridement, and later on it was treated with a combination of platelet-rich plasma as well bone marrow concentrate. In the entire protocols, whatever I could develop from my experience, the patient was initially did an assessment. This assessment gave an idea about his progress with the disease, state of the disease. And then the personalized protocol of each patient was prepared, restricted to the autologous with minimal manipulation using his own bone marrow concentrate and SPF factor, that is adipose and PRP. Even the concentration PRP was different, and administration routes were very important, which gave the criteria of results what I am getting applied. Now in this patient we did a local application maximum and anything else, and within 7 days the wound was healed up completely. This patient was running around 3 months for healing from different doctors, and when he came to me, it was 7th day where he without any information. This is a very good case. This patient was around, when he had come with the pregangrenous state of diabetic. He had been to some other doctor where he was advised SOS amputation. Then he came to me. He had 2 problems. One was the diabetes, second was pregangrenous. So this patient, we did a very specific protocol because I had 2 targets for him. One was his uncontrolled diabetes, which was killing his other organs, whereas the second was the pregangrenous state of the food. What I did for him was a very, very different protocol because he needed a very aggressive therapy. So we did a protocol where we could cover him intravenous dose of transplant of bone marrow derived concentrate as well as adipose derived and a platelet concentrate. He was given intra-arterial doses of adipose as well as bone marrow concentrate at a specific interval, and local with PRP, which was normally we consider the concentration of 3 times of the normal values of platelet in the blood. But in this case, we did around 6 to 8 times more higher concentrations because in my opinion, my experience was saying he needed a lot of healing factors, and that way I could do it with concentrates of high levels in platelets. And at the end of 3 weeks, if you see, he could save his leg completely, whereas he was advised SOS, already amputation. Now, in such situations where the ischemic wound conditions are there, the bone marrow concentrated PRP has worked wonders to save the limbs. This was a wonderful case of burns. 80% burns. Normally we see any burn healing with the deep scar formation, cicatrical formation, and contraction formations. If you happen to see the neck, for this slide I am showing you for one reason, for our neck. Normally if you see, sorry. Oh. Can we go back to the same slide? Fine, thank you. This specific slide I am showing for one reason. She had a knee, facial and neck burns. Anybody would expect the healing with formation of a fixed neck with contracture. Now what I did here, I used collagen sheets along with a small strip of grafting in the skin here and rest of platelet-rich plasma with bone marrow concentrate and adipose-derived cells. At a specific interval, she was given local infiltrations as well as intravenous doses. For the extremities, I added one more principle in her healing was intra-arterial of bone marrow concentrate at a specific interval. And trust me, this lady who was an employee of an electric board of Maharashtra, she's back on duty today with 80% burn, with the same job. In a traditional way, if you would have treated, she would have got a neck contracture in such a way and she would have lost the job. This is one beautiful case of elephantiasis. I haven't heard anybody treating elephantiasis. We ultimately see the patient, you have to live it and die with it. With this patient, I had a just intellectual thought, can we do something for this patient? Because we have all healing factors. You have bone concentrate. Pathology we assessed it. We also know the pathology of the lymphatic system which is not working well, tonic system not working well. We made it a point, prepare a protocol for him rather. A local use of again the same concept of platelets, at least 6 to 7 folds more than bone marrow concentrate as well as adipose-derived. He was given at frequent interval. The frequency of application was very high in this case. Maybe every day I was giving the doses. And if you see the first picture, if you see the skin folds, ulcerations, the man had gone for amputation stage. And after 1.5 months, 2 months, you can see the legs salvaged completely. He now wears the socks and shoe and does his job regularly. This was one mental protocol which I could define. Here also intra-arterial dose I had given with bone marrow concentrate and the results were fabulous. Some of the autoimmune conditions we will see, particularly ankylosing spondylitis. This is one of the favorite diseases which I can boast that will do wonders in this disease condition. This is a patient from Afghanistan who had come with a fixed spine to me, that is bamboo spine. At least I have not heard Syndes trophies of the bone which are formed for fixation of the bones in the long spine. They are reversible. We had done a specific protocol for this because the entire treatment of whatever we did was a personalized protocol for every patient, personalized medicine. In this patient, we made a protocol for same like using bone marrow, 500 plus sugar with ketoacidosis. Initial ketosis was treated and again a specific protocol was prepared in this case where we used a concentrated bone marrow along with adipose, but in this case we gave a transplant intraperitoneal around the pancreas using ultrasound control. At the same time we give intravenous dose also. At the end of, after repeating 2 doses of this, at the end of 1 month we could see the result. His C-peptidase improved very well, he was off the insulin. Now one wonderful part is that most of these internal factories of tissues which are not functioning can be regenerated using stem cells, simple autologous. My talk today is very important for one purpose. We all though think of doing a lot of high research and getting into specialty tissues, but have you ever thought baseline where simple concentrates of bone marrow adipose can do miracle job which can extend the base of treatment for most of the conditions where we don't have any solutions. This is what I want to pass on in today's talk. There are so many conditions where using the basic components of healing factor, still we can do a very big job of healing in many of the conditions. This is avian. This is one again condition where I have a very good file patent on this. I am waiting for the approval of this patent. Minimal invasive technique where we use adipose, bone marrow and PRP at a specific interval and sometimes in between only PRP, intra-arterial under eye control without any surgical. It's a daycare procedure. Patient gets admitted in the morning and evening discharge without anesthesia, use only local anesthesia. And I assure we had 150 cases of this with 3 years follow-up, all of them are doing wonders. Similarly, a case of orthopedics, again osteoarthritis, you can see the stage what's grade 4. Anybody would have gone for a replacement of joint.